NMC-CBT questions and answers. Question number 251. NMC requires in the UK how many units of continuing education units a nurse should have in 3 years? Option A 35 units. Option B 45 units. Option C 55 units. Option D 65 units. The correct answer is option A 35 units. Question number 252. An adolescent primigravida who is 10 weeks pregnant attends the antenatal clinic for a first checkup. To develop a teaching plan, the nurse should initially assess: Option A the client's knowledge of the signs of preterm labor. Option B the client's feelings about the pregnancy. Option C whether the client was using a method of birth control. Option D the client's thought about future children. The correct answer is option B the client's feelings about the pregnancy. Question number 253. If you were asked to take standard precautions, what would you expect to be doing? Option A wearing gloves, aprons and mask when caring for someone in protective isolation. Option B taking precautions when handling blood and high-risk body fluids so as not to pass on any infection to the patient. Option C using appropriate hand hygiene, wearing gloves and aprons where necessary, disposing of used sharp instruments safely and providing care in a suitably clean environment to protect yourself and the patients. Option D asking relatives to wash their hands when visiting patients in the clinical setting. The correct answer is option C using appropriate hand hygiene, wearing gloves and aprons where necessary, disposing of used sharp instruments safely and providing care in a suitably clean environment to protect yourself and the patients. Question number 254. What infection is thought to be caused by prions? Option A leprosy. Option B pneumocystis jirovecii. Option C norovirus. Option D Creutzfeldt-Jakob disease. Option E none of the above. The correct answer is option D Creutzfeldt-Jakob disease. Question number 255. You are told a patient is in source isolation. What would you do and why? Option A isolating a patient so that they don't catch any infections. Option B nursing an individual who is regarded as being particularly vulnerable to infection in such a way as to minimize the transmission of potential pathogens to that person. Option C nursing a patient who is carrying an infectious agent that may be risk to others in such a way as to minimize the risk of the infection spreading elsewhere in their body. Option D nurse the patient in isolation. Ensure that you wear appropriate personal protective equipment PPE and adhere to strict hygiene, for the purpose of preventing the spread of organism from that patient to others. The correct answer is option D nurse the patient in isolation. Ensure that you wear appropriate personal protective equipment PPE and adhere to strict hygiene, for the purpose of preventing the spread of organism from that patient to others. Question number 256. What percentage of patients in hospital in England, at the time of the 2011 National Prevalence Survey, had an infection? Option A 4.6%. Option B 6.4%. Option C 14%. Option D 16%. The correct answer is option B 6.4%. Question number 257. Jenny, a nursing assistant working with you in an elderly care ward, is showing signs of norovirus infection. Which of the following will you ask her to do next? Option A go home and avoid direct contact with other people and preparing food for others until at least 48 hours after her symptoms have disappeared. Option B disinfect any surfaces or objects that could be contaminated with the virus. Option C flush away any infected feces or vomit in the toilet and clean the surrounding toilet area. Option D avoid eating raw oysters. The correct answer is option A. Go home and avoid direct contact with other people and preparing food for others until at least 48 hours after her symptoms have disappeared. Question number 258. Which of the following are signs of anaphylaxis? Option A. Swelling of tongue and rashes. Option B. Dyspnea, hypertension and tachycardia. Option C. Hypertension and hypothermia. Option D. Cold and clammy skin. The correct answer is option A. Swelling of tongue and rashes. Option B. Dyspnea, hypertension and tachycardia, and option D. Cold and clammy skin. Question number 259. You were asked by the nursing assistant to see Claudia, whom you have recently given trimethoprim 200 mg SPO because of urine infection. When you arrived at her bedside, she was short of breath, wheezy, and some red patches evident over her face. Which of the following actions will you do if you are suspecting anaphylaxis? Option A. Call for help and give oxygen. Option B. Give oxygen and salbutamol nebs if prescribed and call for help. Option C. Give oxygen, administer adrenaline 500 micrograms IM, give salbutamol nebs if prescribed and call for help. Option D. Call for help, give oxygen, administer adrenaline 500 micrograms IM, give salbutamol nebs if prescribed. The correct answer is option D. Call for help, give oxygen, administer adrenaline 500 micrograms IM, give salbutamol nebs if prescribed. Question number 260. Signs and symptoms of septic shock. Option A. Tachycardia, hypertension, normal WBC, non-pyrexal. Option B. Tachycardia, hypertension, increased WBC, pyrexal. Option C. Tachycardia, increased WBC, normotension, non-pyrexal. Option D. Decreased heart rate, decreased blood pressure, normal WBC and pyrexal. The correct answer is option B. Tachycardia, hypertension, increased WBC, pyrexal. Question number 261. What is meant by Gillick competent? Option A. Children under the age of 12 who are believed to have enough intelligence, competence and understanding to fully appreciate what's involved in their treatment. Option B. Children under the age of 16 who are believed to have enough intelligence, competence and understanding to fully appreciate what's involved in their treatment. Option C. Children under the age of 18 who are believed not to have enough intelligence, competence and understanding to fully appreciate what's involved in their treatment. Option D. Children under the lawful age of consent who are believed not to have enough intelligence, competence and understanding to. The correct answer is option B. Children under the age of 16 who are believed to have enough intelligence, competence and understanding to fully appreciate what's involved in their treatment. Question number 262. There is a child you are taking care of at home who has a history of anaphylactic shock from certain foods. The nurse is feeding him lunch. He looks suddenly confused, breathless and acting different. The nurse has access to emergency drugs access and the mobile phone. What will she do? Option A. She will keep the child awake by talking to him and call 911 for help. Option B. She will raise the child's legs and administer adrenaline and call the emergency services. Option C. The nurse will keep the child in standing position and try to reassure the child. The correct answer is option B. She will raise the child's legs and administer adrenaline and call the emergency services. Question number 263. You saw a relative of a client has come with her son, who looks very thin, shy and frightened. You serve them food, but the mother of that child says don't give him, he eats too much. You should. Option A. Raise your concern with your nurse manager about potential for child abuse and ask for her support. Option B. Ignore the mother and ask the relative if the child is abused. Option C. Ignore the mother's advice and serve food to the child. Option D. Ignore the situation as she is the mother and knows better about her child. The correct answer is option A. Raise your concern with your nurse manager about potential for child abuse and ask for her support. Question number 264. What is clinical benchmarking? Option A. The practice of being humble enough to admit that someone else is better at something and being wise enough to try to learn how to match and even surpass them at it. Option B. A systematic process in which current practice and care are compared to, and amended to attain, best practice and care. Option C. A system that provides a structured approach for realistic and supportive practice development. Option D. All of the above. The correct answer is option D. All of the above. Question number 265. Which statement is not correct about the nursing process? Option A. An organized, systematic and deliberate approach to nursing with the aim of improving standards in nursing care. Option B. It uses a systematic, holistic, problem-solving approach in partnership with the patient and their family. Option C. It is a form of documentation. Option D. It requires collection of objective data. The correct answer is option D. It requires collection of objective data. Question number 266. The client reports nausea and constipation. Which of the following would be the priority nursing action? Option A. Collect a stool sample. Option B. Complete an abdominal assessment. Option C. Administer an anti-nausea medication. Option D. Notify the physician. The correct answer is option B. Complete an abdominal assessment. Question number 267. What are the key reasons for administering medications to patients? Option A. To provide relief from specific symptoms, for example pain, and managing side effects as well as therapeutic purposes. Option B. As part of the process of diagnosing their illness, to prevent an illness, disease or side effect, to offer relief from symptoms or to treat a disease. Option C. As part of the treatment of long-term diseases, for example heart failure, and the prevention of diseases such as asthma. Option D. To treat acute illness, for example antibiotic therapy for a chest infection, and side effects such as nausea. The correct answer is option B. As part of the process of diagnosing their illness, to prevent an illness, disease or side effect, to offer relief from symptoms or to treat a disease. Question number 268. Which of the following is not a part of the 6 rights of medication administration? Option A. Right time. Option B. Right route. Option C. Right medication. Option D. Right reason. The correct answer is option D. Right reason. Question number 269. An adult has been medicated for her surgery. The operating room, or nurse, when going through the client's chart, realizes that the consent form has not been signed. Which of the following is the best action for the nurse to take? Option A. Assume it is emergency surgery and the consent is implied. Option B. Get the consent form and have the client sign it. Option C. Tell the physician that the consent form is not signed. Option D. Have a family member sign the consent form. The correct answer option C. Tell the physician that the consent form is not signed. Question number 270. What is right in case of consent among children under 18? Option A. Only children between 16-18 are competent to give it. Option B. Parents are responsible to give consent with children. Option C. Children who are intellectually developed and understand matters can give consent. The correct answer is option C. Children who are intellectually developed and understand matters can give consent. Question number 271. An unmarried young female admitted with ectopic pregnancy with her friend to hospital with complaints of abdominal pain. Her friend assisted a procedure and became aware of her pregnancy, and when the family arrives to hospital, she reveals the truth. The family reacts negatively. What could the nurse have done to protect the confidentiality of the patient information? Option A should tell the family that they don't have any rights to know the patient information. Option B that the friend was mistaken and the doctor will confirm the patient's condition. Option C should insist friend on confidentiality. Option D should have asked another staff nurse to be a chaperone while assisting a procedure. The correct answer is option D should have asked another staff nurse to be a chaperone while assisting a procedure. Question number 272. Patient is scheduled to undergo an elective surgery. What is the least thing that should be done? Option A assess obtain the patient's understanding of, and consent to, the procedure, and a share in the decision-making process. Option B ensure pre-operative fasting, the proposed pain relief method, and expected sequelae are carried out and discussed. Option C discuss the risk of operation if it won't push through. Option D the documentation of details of any discussion in the anesthetic record. The correct answer is option C discuss the risk of operation if it won't push through. Question number 273. You went back to see Mr. Darby, who is 1 day post-herniorrhaphy. As you approached him, he complained of difficulty of breathing with respiration rate of 23 breaths per minute and oxygen saturation 92% in room air. What is your next action to help him? Option A give him oxygen. Option B give him pain relief. Option C give him antibiotics. Option D give him nebulizers. The correct answer is option B give him pain relief. Question number 274. A client tells the doctor that she is about 20 weeks pregnant. The most definitive sign of pregnancy is option A elevated human chorionic gonadotropin. Option B the presence of fetal heart tones. Option C uterine enlargement. Option D breast enlargement and tenderness. The correct answer is option B the presence of fetal heart tones. Question number 275. The nurse notes variable decelerations on the fetal monitor strip. The most appropriate initial action would be to option A notify her doctor. Option B start an IV. Option C reposition the client. Option D readjust the monitor. The correct answer is option C reposition the client.